Are you worried about your brain health after playing years of contact sports? So what if I told you there are actually 15 treatable, modifiable targets that we can work on to lower your risk, and most of them are way more simple and unsexy than you think? Hey, I'm Dr. Mark. I'm a concussion specialist. Every year I work with hundreds of people, athletes, parents, grandparents, entrepreneurs, everyone in between, to help them recover from concussion, post-concussion, and get back to work, school, sport, or their everyday life. So in this video, we're going to cover what is CTE, what is chronic traumatic encephalopathy, and why is diagnosing it so complicated? How is this different from traumatic encephalopathy syndrome? And then the bulk of the video, the important part of the video, is knowing that there are actually 15 actionable, modifiable targets that we can use to prevent these CTE, TES, neurodegeneration complications from occurring down the road. So let's dive in. First, this video is about empowerment and not fear. I know there's a ton of fear around chronic traumatic encephalopathy. I won't let my kids play football. I won't do this. I won't do that because head impacts are barbaric and they're for sure inevitably going to lead to CTE. So we're actually going to talk about why that's a lot more murky than you think and how we can actually flip that script to make it more empowered for people who maybe don't have that choice. You already played years of football. You already played I played 13 years of ice hockey. I don't have the choice of taking those head impacts back. So what can I do to change my future outcomes? That's what we're going to talk about. Let's dive in. So before we dive into the 15 treatable factors, let's talk about why the research on CTE is so murky and inconclusive. And that might be a shock to you because mainstream media, New York Times, Twitter will have you believing that no, this one head impact is going to cause CTE. And while CTE is a very real, a very serious condition, the way we study it comes with some significant limitations. So I want to break those down to provide some context for what we're looking at and why we maybe do want to flip the script to something more empowering. So first, CTE is diagnosed after death. CTE can only be confirmed by post-mortem diagnosis, actually going in, looking at the brain and identifying specific tau protein deposits in the brain. We can't diagnose it in living individuals, so there's no way to track the condition in real time and study its progression. 2, there's a selection bias in brain donations because, again, we can only diagnose this after someone's passed away. It's usually a brain donated from an individual that was highly symptomatic or their family was concerned about CTE before the donation in the first place. So this skews the data towards much more severe cases and doesn't account for the percentage of people that are maybe asymptomatic or who have a much more mild pathology. Third, study sample sizes. So brain bank studies usually include fewer than 50 cases. So it makes it really, really difficult to generalize findings and identify patterns that would go across larger populations of people. 4, and this is a big one, is that the symptoms of CTE overlap a lot with treatable conditions. So mood swings, memory loss, behavior changes. Symptoms attributed to CTE often mimic conditions like depression, anxiety, PTSD, sleep apnea, and these overlaps make it really hard to pinpoint what's truly caused by repetitive head impacts and what is just sort of an independent treatable condition. 5, lacks of control groups. Many studies don't compare athletes to non-athletes. We don't have a baseline of here's a healthy person and here's someone with symptoms. Without a baseline, it's actually hard to determine if these changes are unique to CTE, unique to repetitive head impacts, or just a different condition, a different part of the normal aging process. We don't actually have a ton of that data. And then I kind of alluded to it before, but there's pathological ambiguity. So basically saying that the tau protein deposits found in CTE overlap with other neurodegenerative conditions like Alzheimer's and age-related tauopathies. So this raises the question whether all cases labeled as CTE are truly distinctly CTE. There's a focus on high-profile cases, usually because the media attention goes towards extreme cases, usually in professional football players. And so these stories absolutely important, but they create this perception that CTE is inevitable for anyone exposed to repetitive head impacts at any age, at any level, and it overshadows this individual variability that we're going to talk about in this video. And then last, we're going to talk very briefly about TES, traumatic encephalopathy syndrome. There's no great criteria for that yet. So TES is the clinical syndrome used to describe what we think would be CTE, but in living individuals. And the problem is that this diagnostic category right now, there was a consensus paper on this trying to say, how do we categorize people with TES? And what we find is it's really broad and it's still evolving. And the reviews of it so far, how well does this hold up, finds the TES criteria that we have has a huge risk of overdiagnosing and misdiagnosing people as CTE when it's not. So these challenges really highlight why the research on CTE is inconclusive. But the good news is that it's inconclusive. So the story is probably not as bleak as we think it might be. Many symptoms that we attribute to TES or CTE overlap with treatable conditions: depression, sleep apnea, chronic inflammatory conditions. So that means there's a lot that we can control, and that's what this video is about. So let's dive into 15 actionable ways to protect your brain. Now, keep in mind, I don't know if I already said this, but I had to pour through 32 different studies, systematic reviews, the studies that made the headlines, studies that didn't make the headlines to kind of come up with this. These are all conditions, confounding conditions, comorbidities, things found in these patients that we can treat that are manageable. So we're going to start with the basics, and that's your overall health. These conditions are the foundation for risk or resilience. They kind of tip the needle, risk or resilience. The first one would be obesity. And this isn't to be offensive. This is just obesity drives systemic inflammation. We have TBI specific data on your inflammasome and what adipocytes, fat cells do to that. And we find that obesity drives inflammation. It makes the brain more vulnerable. We're not going to talk about how, but we know that losing just 5 to 10% of your body weight can do dramatic things to your inflammatory levels, dramatic things to your blood sugar control, dramatic things that tip the scales towards resilience rather than risk. And there's no shame in GLP-1 or however you want to go about this, but obesity is a risk factor. Diabetes and metabolic diseases would be the next thing. So high blood sugar can accelerate tau buildup, can accelerate vascular damage, blood vessel damage in the brain. So again, glycemic control through diet and exercise significantly reduces this risk. And again, if you need medication for glycemic control, go there. Hypertension, high blood pressure can damage blood vessels in your brain. Usually if you've got problems in big vessels, you're going to have problems in small vessels. So vessel damage contributing to cognitive decline, regular exercise, DASH and Mediterranean diet, different things to reduce your blood pressure, to reduce your risk. It sounds really simple, but managing your weight, your blood sugar, and your blood pressure, huge, strong foundation for building your brain health. Next, let's talk about sleep. So it's sort of the ultimate repair tool for your brain. One of the things we see a lot in retired athletes, in these patients with CTE, is that there's a lot of folks who have sleep apnea. And untreated sleep apnea disrupts oxygen flow to your brain, increases inflammation, it impairs sleep staging. All of that is going to change how your brain clears toxins, how you recover at night, neuroplasticity, all the fun stuff that sleep does. CPAP, weight loss, other therapies to address the sleep apnea can restore oxygenation, reduce cognitive deficits. As a personal patient story, I had someone where their post-concussion symptom scale, their score was in the 90s. So this symptom severity scale that goes up to 132, they were in the 90s. The week they started their CPAP, we dropped 70 points into the 20s. It was insane how much improving his sleep helped this guy who thought he had long-term neurological problems just imminent for him. In addition to sleep apnea is just general insomnia. Poor sleep prevents your brain, again, from clearing waste like tau proteins. It could be as simple as cognitive behavioral therapy. It could be melatonin. It could be sleep hygiene routines. It can be a whole bunch of other interventions to improve your sleep quality and sleep quantity. But please, in addition to blood sugar, blood pressure, weight management, prioritize your sleep. It is when your brain clears toxins and repairs itself. So once you've optimized your foundations and you've optimized your sleep and recovery, it's time to look at things like chronic pain and stress, which silently kind of in the background will affect your brain health over time. So we know that a lot of these athletes dealt with chronic pain. We've got research on chronic pain and brain mapping and all this other fun stuff. But chronic pain disrupts emotional regulation, increases neuroinflammation, does a whole bunch of fun stuff, fun around in quotes, but mindfulness meditation, physical therapy, nutraceutical, even pharmaceutical management, when used appropriately, are effective ways to break that pain cycle. Traumatic stress. Chronic stress elevates cortisol. Consistently elevated cortisol can actually shrink hippocampus, it can impair memory, it can impair mood. Again, cognitive behavioral therapy, biofeedback, yoga, mindfulness meditation, just improving your sleep, as we talked about before, can improve all of this. Managing your pain, managing your stress protects your brain and your emotional well-being. So now let's talk about some of the internal balances that can amplify your risk if left unchecked. One of the ones that will resonate with many of the male athletes, particularly those football players, would be low testosterone. We find that low testosterone affects mood, energy, memory, your ability to recover. TRT, testosterone replacement therapy, under clinical guidance can restore that balance and sort of restore energy, vitality, that sort of good feeling that you want back. Subclinical neuroinflammation, and this is one that's much more nebulous and not necessarily as black and white to diagnose, but we've got chronic inflammation. Could be due to the chronic pain, could be due to gut-brain axis dysregulation after the head injuries, could be due to a multitude of things. Just a poor diet, Western standard American diet, just continually fueling you every day. But we know that chronic inflammation fuels neurodegeneration. So moving more towards an anti-inflammatory diet that's so nebulous. If you had to pick one, move towards a Mediterranean style diet. It has the most research. It's the most kind of socially practical. And then supplements like omega-3 based on an omega-3 index, turmeric if clinically indicated, other different different things to manage inflammation. But reducing inflammation, optimizing your hormone levels will help keep your brain functioning at its best. Now let's address some life choices that can tip that needle towards risk or resilience. The first one would be alcohol. Alcohol is on the decline, at least according to stocks and money and stuff like that. People are just buying less alcohol, moving towards non-alcoholic drinks or cannabis. But excessive drinking, we know that no amount of alcohol is safe for the brain. There's no amount of wine, no matter how much resveratrol is in it, there's no amount of alcohol that's safe for the brain. Excessive drinking inflames the brain, impairs recovery. It impairs recovery by impairing sleep, among other mechanisms. But if we can reduce alcohol intake, we can improve emotional health, sleep health, gut health, heart health, cancer risk, all sorts of things just by reducing alcohol intake. The other thing would be other substance use. And the big one that comes up in the CTE research is opioids. Opioid misuse worsens cognitive and emotional regulation. It can impair gastrointestinal health. Non-opioid pain management strategies are essential to pick up if you're worried about things like CTE. So to recap sort of the lifestyle choices, mindful moderation and alternative treatments will build resilience and recovery and kind of tip that needle away from risk. So let's focus on fuel and movement, 2 ways to keep your brain healthy. One would be poor nutrition and physical inactivity. And this kind of would go back up to the foundations of the health of like weight management, blood sugar management, and blood pressure management. But I've talked about numerous times is that poor nutrition, so diets high in processed food, ultra processed foods, thinking more refined carbs, more saturated fats, more trans fats, it's going to be poor for blood sugar regulation, poor for gut health, inflammation, all that fun stuff. And so again, the more we can move more towards like a Mediterranean diet, more omega-3s from the diet, more whole foods, less processed foods, the better it's going to be for brain health. And we see this across, again, data in NFL players and all sorts of stuff. Physical inactivity. So I've got a video that I just filmed on how one of the biggest mistakes that non-athletes make is not remaining active after the concussion rehab. We also see the same thing in retired athletes. Once the sport is over, they don't really have anything to train for or play for. There's sometimes an identity crisis, an identity shift when the career has to end, especially if it's due to injury like concussion. But we know that exercise boosts neuroplasticity. We know that head to head, people with high tau in their brain who exercise versus don't exercise have slower rates of cognitive decline if they do exercise. Physical inactivity is a problem. Staying active with moderate to vigorous physical activity is fantastic for your brain. Last thing is to talk about mental, emotional, and social factors that can protect your brain or hurt your brain. A big one would be anxiety, depression, PTSD. So mood disorders through cortisol, through other things, are going to shrink the hippocampus. That's going to affect memory. When we introduce therapies that impact mental health, we see that physical and cognitive symptoms will go down too. So particularly in the neurodegenerative world, you'll see talk of like psychedelic mushrooms. And the interesting part about this is it may drive neuroplasticity, but neuroplasticity doesn't mean new neurons, it means new connections. And the other thing about neuroplasticity is if there's nowhere to guide it, it's non-specific. So chronic pain is a form of neuroplasticity just as much as learning music is a form of neuroplasticity. So when we look at the research on things like psychedelics in long-term brain health, the benefit is probably coming from the mental emotional benefit more than the plasticity. When we look at the research on psilocybin and things like that, it's mostly how can we help someone with terminal cancer overcome the diagnosis? How do we help them overcome the depression? How do we help them overcome the mental emotional hurdle of a terrifying diagnosis like that? And so if we use it in someone for depression, for PTSD, and they get better, it's not that your brain became plastic and you overcame CTE, it's that your mental health improved. And that improved your physical and your cognitive symptoms as well. And that might be a tough pill to swallow, but it's improvement. The other thing is social isolation, and this might be a problem more in men than women, but loneliness can accelerate cognitive decline. Building strong social networks. If you can exercise outdoors at moderate activity levels and there's an element of play to it, you just knocked out a whole bunch of the risk factors by having social engagement, being physically active, and having sort of the plasticity of play improve your brain health. So again, connection matters. A strong social support system, appropriate recognition of your mental health can protect your brain and your well-being for a long time. So that was a lot, but these 15 factors can transform your brain health. Start small, whether it's improving your diet, getting better sleep, just increasing your steps from 4,000 to 6,000 a day, reaching out to someone you trust for a conversation, for a coffee to kind of break the loneliness cycle. Whatever you can do to move that needle closer to resilience, do it. So which of these are you going to start with? Let me know in the comments. Thank you for watching. Go ahead and like, subscribe, hit the bell, do all the YouTube things. It's free for you. It helps me out. And remember, brain health is in your hands. Small changes today, like compound interest, they're going to have big differences tomorrow. Until next time, I'm Dr. Mark.